My name is Donna Meyer. I'm President of the National Organization for Associate Degree Nursing and Dean of Health Sciences at Lewis and Clark Community College. I'm here today to talk to you a little bit about the profession of nursing. Nursing is often considered an art and a science. An art because you are touching people's lives on a daily basis, and a science because you have to have so much knowledge to be a nurse. Nursing is also the largest healthcare profession in the country with approximately 3 million nurses. There are two pathways to becoming a registered nurse. First, you can attend a community college and receive an associate degree, and you will be eligible to take the national licensing exam to become a registered nurse. Or you could begin at the university and complete a bachelor's degree. You also, at that time, would be entitled to take the licensing exam for a registered nurse. Both are wonderful pathways. However, it is imperative for nurses to continue their education if they begin at a community college and to pursue a bachelor's degree. If you take a program at both a community college and a university, you will be taking courses in humanities, which would be things like psychology, child psychology, ethics, different types of philosophy and sociology courses. You also will be taking many science courses and math courses. Sciences would be such courses as anatomy and physiology, pathophysiology, microbiology. These courses are imperative for a nurse's knowledge when she or he is taking care of a patient. You also will be attending many clinicals in your nursing professional career as a student. You would have a clinical perhaps in medical surgical nursing, OB nursing, mental health nursing, long-term care facilities, also such areas as public health. If you continue your education or if you go to a university, you will also be taking courses in leadership and research. These are also essential courses because nurses, as they advance in their career, are actually doing research in the patient care setting. Once you complete your education at a community college or a university, you will be eligible to work as a registered nurse once you've passed the licensing exam. There are so many different opportunities for a registered nurse for employment. For example, nurses work in hospitals or, as they're referred to, acute care settings. In a hospital setting, you might work in the operating room, the intensive care unit, the emergency room, a medical surgical unit, even a mental health unit. So there's many opportunities just in a hospital setting alone. However, there are many changes occurring in healthcare because of the Affordable Care Act. As a result, much of the healthcare is being moved into the community setting, so nurses' roles are changing. They may work in a public health department, different types of clinics. Many of you are familiar with the retail clinics, as they refer to, such as the retail clinics at a large drugstore system, or even like a Walmart. Nurses also can work in hospice, home health care, so there's many opportunities. The other thing about nursing is it is somewhat flexible as far as your hours. Most hospital settings, you would work 3 shifts a week, which are 12-hour shifts. But as a result, there is some time off with that. Also, there's options called weekend options, where nurses only work on the weekends. So there's many types of opportunities for nurses as far as their employment setting as well as their work hours. There's also opportunities that people sometimes don't think about when it comes to nursing, and that's actually in what is referred to as medical sales. Many nurses can work in sales for medical supplies, pharmaceutical supplies, or even in educational setting related to textbook sales. I always tell the story that one of my favorite textbook representatives is actually a nurse because she actually understands what's needed in a nursing textbook. So as you can see, there's many variety of opportunities if you complete your education as a nurse. It's also very important that nurses think about continuing their education to the master's and doctorate level. There's additional opportunities for nurses if they continue their education. For example, if you obtain a master's, you become a nurse practitioner. There's many areas in nurse practitioners. For example, pediatric, adult, family, even mental health. Those are very specific areas for nurse practitioners. You also could become a nurse anesthetist or a nurse educator. Nurse educators are extremely important because they are educating the workforce of tomorrow in nursing. You must have a minimum of a master's degree to teach nursing, and that would be in the community college. If you prefer to teach at the university level, you would have to have a doctorate or a DNP. Let me explain the difference. A PhD in nursing is actually more concentrated in research, but of course can teach at the university level. A DNP is a doctorate in nursing practice and is more concentrated in practice. Both are wonderful options, and an individual just has to decide what's best for them. I've given you a very brief overview about the education and some of the practice settings for nurses, but let me talk a little bit about the quality for a person that needs to be a nurse. First of all, you have to be extremely caring and very empathetic because you are touching people and touching people's lives. Additionally, you're not only working with an individual, but most often you are working with an entire family unit. It's a very complex profession, but it's a wonderful profession and extremely rewarding. I can tell you from personal experience that when you leave at the end of the day and walk out of the hospital or the clinic, you feel a sense of pride because you have helped an individual. I hope you will consider the nursing profession because it is a wonderful profession with many opportunities. Thank you.